Imagine waking up, yet again, with that all too familiar feeling, pressure in your face, stuffy nose, and a pounding headache that just won't quit. If this sounds familiar, you might be dealing with a sinus infection. Many people mistake sinus infections for the common cold, but not all sinus infections are as harmless, or as contagious, as a simple cold. It's time to get to the bottom of this, so let's unravel the mystery of sinus infections and see what makes them tick. 1. What is a sinus infection? Sinus infections, or sinusitis, are not just an annoying inconvenience, they occur when the air-filled spaces in our faces, our sinuses, become infected. These hollow spaces are found on either side of the nose, in the cheeks, behind the nose, and even in the forehead. Normally, our sinuses are empty except for a thin layer of protective mucus. But when they get infected, they can fill with more mucus, swelling, and cause intense discomfort. This infection can be caused by different things: viruses, bacteria, fungi, or even physical blockages. So while the symptoms of a cold and a sinus infection might feel similar, the way these conditions develop, and how they spread, isn't always the same. 2. Causes of sinus infections, viral versus non-viral. When it comes to sinus infections, what causes the infection determines whether it's contagious or not. Viral sinus infections are contagious. They spread just like the common cold, by touching surfaces, sneezing, or coughing. On the other hand, sinus infections caused by blockages, allergies, or structural issues in the nasal passages are not contagious. These blockages could be due to anything from nasal polyps to a deviated septum or even chronic allergies. To simplify, if a virus is behind it, it's likely contagious. If something physical is causing it, there's no need to worry about spreading it. 3. Types of sinus infections. Now, sinus infections aren't one size fits all. They're categorized based on how long they stick around. Acute sinusitis lasts less than 4 weeks and is often viral. Subacute sinusitis persists for 4 to 12 weeks, often requiring more than over-the-counter medications to resolve. Chronic sinusitis lasts over 12 weeks, and often involves structural issues, or ongoing inflammation. Recurrent sinusitis comes back several times a year, leading to ongoing discomfort. Each type can have different causes, from bacteria to fungi, or just simple inflammation. The symptoms of these infections vary slightly, but chronic cases are more likely to cause fatigue, severe congestion, and prolonged pressure in the sinuses. 4. Common symptoms, sinus infection versus common cold. So, how do you know if you're dealing with a sinus infection or just a cold? Let's look at the common symptoms. Similar symptoms: nasal congestion, sore throat, and cough. Sinus infection-specific symptoms: pressure in the sinus areas, cloudy or greenish nasal discharge, bad breath, pain in the teeth, ears, or one side of the face, fever, especially with bacterial infections. If symptoms last longer than a week and are severe, it's more likely to be a sinus infection than a cold. 5. Bacterial sinus infections and when to seek help. Sometimes, a sinus infection isn't just a minor annoyance, it's a bacterial infection that needs more attention. Bacterial sinusitis often has some telltale signs, like pus-like nasal discharge, facial pain symptoms that persist beyond a week. In cases like this, antibiotics may be necessary. If you experience intense sinus pain, a high fever, or symptoms that linger, it's time to consult a doctor. While antibiotics won't help viral sinusitis, they can be essential for bacterial cases. 6. Treatment options, from home remedies to medical treatments. Most sinus infections don't require heavy-duty medications. Here are some common treatments. At-home remedies. Nasal irrigation. This is a method to flush out mucus and allergens. Steam or humidifiers. Using steam helps to open nasal passages. Essential oils. Oils like eucalyptus, lemon, or lavender might help with sinus pressure, just use them safely. Over-the-counter medications. Pain relievers, such as acetaminophen, can help with facial pain. Decongestants. These reduce mucus production, helping to clear congestion. Combination cold medications. These target multiple symptoms at once, like pain and cough. If these approaches aren't working, medical treatments can be considered. Nasal sprays. Corticosteroid sprays reduce inflammation in the nasal passages. Oral steroids. For severe cases, doctors may prescribe steroids to reduce swelling. Antibiotics. For bacterial infections, a 2-week course of antibiotics is often recommended. For chronic sinusitis, doctors might suggest more intensive treatments, such as steroid injections or even surgery, to improve drainage in the sinus passages. 7. When should you see a doctor? It's tempting to power through a sinus infection, but there are times when seeing a doctor is essential. You should get professional help if symptoms last longer than a week without improvement. You have a high fever, severe facial pain, or swelling. There is persistent thick, greenish nasal discharge. The infection keeps coming back. Doctors may ask about your symptoms, check your nasal passages, and even look at your teeth or ears to determine the source of pain. By ruling out serious causes, they can tailor a treatment plan just for you. 8. Staying healthy and preventing sinus infections. The best way to deal with a sinus infection is to prevent it. Here are some ways to protect your sinuses and reduce your risk. Stay hydrated. Drinking plenty of water keeps mucus thin and easier to clear. Use a humidifier. Dry air can irritate your sinuses, so using a humidifier, especially in winter, helps. Wash your hands. Viruses often spread through touch, so regular hand washing is key. Manage allergies. If you have allergies, use medications or avoid triggers to reduce the risk of inflammation. Avoid irritants. Cigarette smoke and pollution can inflame your nasal passages, making you more susceptible to infections. By incorporating these habits, you can help protect yourself from sinus infections and breathe easier year-round. Conclusion. Dealing with a sinus infection can feel like a never-ending cycle of congestion, pain, and frustration. But knowing what causes these infections, and how to treat and prevent them, can help you get back to feeling like yourself. Whether you're fighting a one-time infection or dealing with chronic sinusitis, there's a solution out there for you. So next time you wake up with that familiar pressure, remember, you've got options, and relief is closer than you think. Thanks for watching. If you found this information helpful, don't forget to hit that like button, subscribe for more health tips, and share this video with anyone you know who's struggling with sinus infections. Take care, and breathe easy.